So just with respect to that, if someone had no knowledge of IMS and they thought that they'd got a patient with, say, chronic pain that would be displaying some of these signs, what sort of things would they be looking for that they could look at their patients now and think, that's interesting, I hadn't noticed that before, that then might be quite receptive to IMS? What sort of things would they need to look for in their patients?
All in the peripheral nervous systems. And a consistent one that's very reliable is that fluid leaks out from the cells and it goes into subcutaneous tissue. It's like edema, but it's not ordinary edema due to kidney or heart trouble. It's due to neuropathy in the cells. And this fluid leaks out, and you can pick it up by using a matchstick and pressing it upon the part, and you will leave a dent. It's all described and published, and they're very important, and it's all in the textbook of pain. But unfortunately, the important textbook of pain by Bonica is not well known here.
I don't know.
Yes, it's called The Treatment of Chronic Pain by John Bonica, Bonica, and that's the textbook of pain. And in it, I wrote the chapter on musculoskeletal pain.
Okay.
So you have to understand the philosophy.
Yes.
But once you know what to do with it, you would give up all other types of treatment because it's so effective.
So how would, for people who look at IMS, you're looking for, these areas with respect to the changes of the fluids, such as the matchstick, and there are some other signs that
these are all segmental signs.
Yes.
The body is built into some 30 segments, and any pain that comes from it belongs to a segment. And I think the important thing to believe and understand is that when you have a segment that's not well, the segment creates dysfunction within the body. Say, for instance, if you have trouble in the neck, it goes into a shoulder, and the back of the neck causes headaches. From in front, it goes to the heart. So a lot of these things do not cause pain initially, but it causes dysfunction.
With respect to sort of the day-to-day caseload that physiotherapists, say, for example, or doctors over here would see, how quickly would you be expecting results with respect to IMS? So someone came in and they've got low back pain of 10, 20, 30 years standing, and they come in and see an IMS practitioner for the first time. How quickly are we expecting them to see significant changes?
Well, the longer they had the pain, the more extensive it would be.
Okay.
But basically, the aim of IMS is to stimulate the nerve and restore it to normal. So you can actually look at the pain, say a frozen shoulder. That's very typical.
That's
a frozen
common,
shoulder can be pain for 2-3 years, and been through all the usual things. And if the patient was unfortunate, they may undergo surgery. But IMS can probably, 1 or 2 treatments all you need is IMS.
Wow.
And that's what really happens. And once you learn IMS, as I said, you forget all other therapy because it's very specific. You look for specific physical signs, and when you do something, those physical signs must disappear. For instance, in a frozen shoulder, if you cannot lift your arm above 90 degrees and you free the muscles that tight, you should get the full range right there.
With what you said about treating muscles there, with respect to acupuncture over here, there would be obviously traditional Chinese acupuncture. People might talk about dry needling then and talking about treating trigger points. As a whole philosophy and as a treatment, how different would it be to treating trigger points, because you're treating sort of tight bands in muscles and releasing them, and you can see some impressive changes? Where would be the differences that you would think?
Well, a trigger point, are real things. They are tender points within muscle, but it's only one part of a total neuropathic picture.
Right.
So you want to get rid of the cause of the neuropathy, not just the points that are painful. So you must know the physical sign
Yes.
to direct you to the nerve root that's in trouble.
Okay. And the course would teach people to do that, to go through the systematic assessment and treat that.
Once you have been trained in IMS, you are a different person. It's really amazing. That's why it's so popular.
Yes.
And that's why it spreads quickly, because the people who have done it would pass the word on.
Mm.
And if you have a backache or neck ache or whatever, or whiplash, IMS is extremely effective in whiplash, which traditional acupuncture is not so good.